Hi, welcome back to our mini series on health. Today I'm going to talk about heart failure. What is heart failure? According to scientists, heart failure is a chronic condition in which the heart is unable to pump blood as well as it should. What are the signs and symptoms of heart failure? From observation and clients' experience, some common signs of heart failure are shortness of breath while performing regular activities. This means that the heart cannot keep up with the blood supply. Therefore, it causes fluids to back up in the lungs and elsewhere. Other signs are swelling or edema in the legs, feet, ankles, abdomen, and genital area because the heart cannot pump strongly to manage the workload. A dry, hacking cough that doesn't go away. This is caused by fluid backing up in the lungs. Trouble sleeping when laying down to sleep flat. Again, this is caused by fluid backing up in the lungs. Rapid weight gain. Example, gaining 3 or more pounds per day. Feeling tired. The limited blood supply is sent away from the arms, legs, abdomen, and muscles to the brain and heart, and so the individual is fatigued. What is the statistic for CHF? According to research, more than 5 million people in the US suffer from chronic heart failure, and it is the most common diagnosis in hospitalized patients. I would also like to highlight that we can categorize heart failure as right-sided, left-sided, and biventricular. Right-sided heart failure occurs because the right ventricle is weak and cannot pump enough blood. This phenomenon causes fluids to back up in the blood vessel, and this leads to fluid buildup in the arms, legs, abdomen, and genital area. While in left-sided heart failure, the cause is usually coronary artery disease, a heart attack, long-term high blood pressure in the lungs, COPD, or pulmonary embolism. However, left-sided heart failure that causes fluid to back up in the lungs sometimes result in a condition called pulmonary edema, where the client experiences frothy pink sputum. Such condition is an emergency and you need to call 911 right away. In biventricular heart failure, both sides of the heart are affected. Therefore, there is fluids in the lungs as well as in the extremities, abdomen, and genital area. How is heart failure diagnosed? Diagnostic tests for chronic heart failure include blood tests such as BNP, CBC, cholesterol, and renal panels. Other diagnostic tests are EKG, echocardiogram, cardiac cath, chest x-ray, spirometry, and peak flow test. What is the treatment for chronic heart failure? Treatment for chronic heart failure depends on how bad it is. However, your doctor may recommend eating less salt, limiting fluid intakes, daily weights, as well as using prescription medications like diuretics, beta blockers, ACE inhibitor, calcium channel blockers, and he may recommend a cardiac consult and also dietary supplement. Is there anything you can do for CHF besides taking medication? Self-care for chronic heart failure include physical exercise, smoking cessation, eating a healthy diet, and reducing alcohol intake. And that brings us to the end of our mini series on chronic